Good morning, everyone. We'll begin today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. Alex Jahangir, Chair of the Metro Board of Health and the Metro Coronavirus Task Force. This morning, we are joined by Brian Hassett, President and CEO of the United Way of Greater Nashville, and Butch Spearden, President and CEO of the Nashville Convention and Visitors Corp. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metro Public Health Department, are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. 5 weeks ago today, we first announced the roadmap for reopening Nashville. And that's a phased, data-driven approach for restarting our local economy and safely getting Nashvillians back to work. With your efforts and dedication to public health, we are quickly approaching the end of the first week of Phase 2 of the roadmap. Now, remember, less than 2 months ago, the state's COVID-19 Unified Command was preparing the Music City Center as a 1,600-bed alternative care site in anticipation of what we feared would have been a system-breaking surge in hospitalizations by mid-May. Now, unfortunately, updated modeling indicates that our efforts have helped to significantly slow the spread of the virus. To date, Nashville has conducted over 55,000 tests, or 79.3 out of every 1,000 residents. As we establish our reputation for safety, this puts us way ahead of many of our peer cities. For example, Austin, Texas has tested just 15.3 out of every 1,000 residents, and Charlotte, North Carolina has tested 18.6 out of every 1,000 residents. Nashville's 79.3 rate exceeds much larger cities like Chicago at 49 per 1,000, Washington, D.C. at 26, and even San Francisco, one of the nation's first COVID-19 hotspots, has tested just 67 out of every 1,000 residents. In fact, of all the cities that I've mentioned, Nashville is the only one to meet the daily average testing threshold for reopening based on CDC and IHME data ever since our phased reopening began on May the 11th. Now, to paraphrase Dr. James Hildreth, we are fighting an invisible enemy made visible through testing and contact tracing, and the results remain encouraging. Our 14-day new case trend remains stable. Our hospital capacity is satisfactory, and we are continuing to increase our ability to conduct contact investigations. But we can't take our hard-earned progress for granted. The coronavirus has touched all Nashvillians, and many of our residents have made tremendous sacrifices to help flatten the curve in our community. Now, I urge everyone to continue taking prudent measures to protect your health. Remember to wash your hands regularly, wear face coverings in public, and maintain a safe social distance from one another. And I'm grateful to all local business owners and employers who are closely following all public health orders and operating in good faith when it comes to the safety of our residents. We are asking for everyone's compliance, and we will continue to take appropriate enforcement actions to protect the safety and well-being of all Nashvillians. As we continue to reopen our economy, please bear in mind that public health will always be our priority. And if necessary, we will revert to an earlier phase in our roadmap to keep everyone safe. Remember to protect what we have achieved. Protect your staff and customers. It will pay dividends for you and for the future of our community. As a reminder, you can view the updated roadmap and leave your feedback at any time by visiting the Metro COVID-19 website. There you will also find a helpful online toolkit with sanitization guidelines, employee screening protocols, and other important information for local business owners who are reopening or expanding their operations during this time. Now, this morning, I'd like to welcome Brian Hassett, President and CEO of the United Way of Greater Nashville. To date, the COVID-19 Response Fund, created with the help of the United Way, has raised nearly $4.7 million and has allocated more than $2.4 million to nearly 100 community partners that are providing direct individual assistance to Nashvillians. These partners include the Community Care Fellowship, which provides housing support in Davidson County, the YWCA of Nashville and Middle Tennessee, and its Domestic Violence Crisis Center and youth villages for their mental health counseling efforts. As always, please consider contributing to the COVID-19 Response Fund or visit Metro's COVID-19 website to learn how you can obtain direct financial, food, mental health, and social service assistance. It's also my pleasure to welcome Butch Spearden, President and CEO of the Nashville Convention and Visitors Corporation, who is here to provide an update on their ongoing partnership with the health care and hospitality providers here in Nashville as we continue our economic reopening strategy. Yesterday morning, I announced an online fan favorite competition in partnership with the Nashville Songwriters Association International. Nashville has a rich history of consoling and encouraging our neighbors with the gift of music during uncertain times. Now, in our fight against the coronavirus, we could all use an anthem to help inspire us in the ways that only music can. Please visit the Metro COVID-19 website today at covid19.nashville.gov and vote for your favorite song. As a reminder, the distribution of free masks will continue this weekend at Hartman Park Community Center, Bellevue Regional Community Center, Smith Springs Community Center, and Madison Community Center on Friday, May 29th and Saturday, May 30th from 9 a.m. until 1 p.m. And now I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. We now have 5,147 confirmed cases. That is an increase of 79 cases in the last 24 hours. The rolling 14-day average of new cases still remains flat. 58 Nashvillians have died as a result of COVID-19. 1,152 cases are active, meaning that 3,937 residents, or 76% of all cases, have recovered and have been cleared. Some updates on our other metrics that we are measuring. A doubling rate of the virus is now 38.4 days. This means that it will take more than 38 days for the number of cases to double. This is an improvement from 29 days just 7 days ago. The goal for this is 13 days or more, so this is very encouraging. Our transmission rate is still slightly below 1. The transmission rate is the number of cases on average an infected person will cause during the infectious period. For us to get ahead of the virus, the number needs to be below 1. Our hospital capacity also still remains stable. There are 25% of all hospital beds available, and 22% of all ICU beds are currently available. Testing also continues to improve in Nashville. Close to 56,000 individuals have been tested since the beginning of this epidemic. Of the 56,000, 9.4% have tested positive. The positive rate has remained at 10% or less since mid-April. This shows that not only that we have adequate testing in our community, but that the virus is stable in our community. Our metrics are encouraging, and I encourage you to go to covid19.nashville.gov to see the updated graphs and data on these metrics. However, remember, we are just 4 days into phase 2. There has not been a decision made regarding phase 3. We expect to make that determination over the next week or so as we have more data in to review. Now today, the community assessment centers are open until 3 p.m., and medical personnel are standing by at our assessment hotlines. These two resources are there for you if you have any concern about this virus. You can get information and get assessed through our hotline, and you can get assessed and tested at one of our assessment centers. Our assessment centers are located at Nissan Stadium, at Meharry Medical College, and at the old Kmart in Antioch. The centers are open Monday through Friday from 9 a.m. to 3 p.m., and our assessment hotline is open 7 days a week from 7 a.m. to 7 p.m. We have had restrictions in place for over 2 months now. And look, I'd realize we're all tired of these restrictions and of fighting this virus. But I understand that we all want to get back to normal as soon as possible. And if you have not been impacted directly with this virus, either by having it or knowing someone who has had it, you may be wondering why we need to continue. Now, what we've learned about this virus is that it affects everyone, young and old, healthy and sick, male and female, black and white. We've learned that humans are the vectors. It is easily spread between people. You can spread the disease without even experiencing symptoms. So you may feel healthy, but you can still have the virus and spread it to someone else. Perhaps someone that has worse medical conditions and will impact them worse than it impacted you. And we've also learned that we can slow the spread by changing our behaviors, whether that's keeping your distance, wearing a face covering, or getting tested if you're concerned about the virus, or staying at home if you are sick. All of these are important steps that you can take. And we know that this works because that's what we've been doing, and it's what's helped make Nashville so successful in our response. Please keep your focus, Nashville, and please continue doing what you are doing. I now would like to introduce Mr. Brian Hassett of the United Way. Thank you.
Thank you, Doctor, and thank you, Mr. Mayor. The United Way COVID-19 Response Fund was formed as a partnership between the Mayor's Office, the United Way of Greater Nashville. Senator Bill Frist leads a committee that is charged with raising and distributing the funding to help our fellow citizens in need affected by the virus. To date, just under $5 million has been raised and $2.44 million has been distributed to hundreds of organizations in our community. We are using data collected by our 211 helpline and charity tracker to make sure that the funding is being utilized to help with the most pressing needs. Housing in the form of direct rent and mortgage assistance, food and medical care have been some of the largest issues. Mental health, counseling, and crisis intervention are quickly rising as the weeks have gone by. Over $800,000 in rent and mortgage, food bills, and transportation assistance has been distributed to date. In addition, thousands of cases of PPE and medical supplies have been distributed to our area hospitals, senior citizen centers, and medical clinics and free clinics. Other services now being funded include direct food assistance, crisis counseling and suicide prevention, PPE supplies for frontline healthcare personnel, childcare and educational supports for families who have their children at home, and telehealth services. I'd like to thank the close to 100 nonprofit organizations struggling to help so many in need in our community, especially NeedLink, the Salvation Army, Catholic Charities, the Martha O'Brien Center, Conexión, Rooftop, and Second Harvest. For a complete list of the organizations supported, please visit our website at NashvilleResponseFund.com. I'd also like to thank all of the donors, close to 1,000, who have supported this so far, including the major gifts from the Frist Family Foundation, the HCA Healthcare Corporation, the Tennessee Titans, Nashville Soccer Club, Nashville Predators, Nashville Convention and Visitors Corp., and the faculty and students at Fisk University. If you need help, call 211. It's there 24 hours a day, 7 days a week, and we have many languages available. If you want to help and you want to speak about contributing, please call me directly at 615-780-2432 or visit our website at NashvilleResponseFund.com. Thank you so much. And I'm going to introduce Butch Spiriton from the Nashville Convention and Visitors Corporation.
Thank you, Brian. Thank you, Mayor. Appreciate it. Good morning. Today, I'm proud to announce a new free citywide initiative called Good to Go. This program brings together Nashville businesses in order to have a broad and consistent response around health and safety in light of COVID-19. We're working closely with Vanderbilt and Metro Health, and we appreciate the contribution of Ryman Hospitality, who we discovered was already working with Vanderbilt and offered to share their research and their progress so far. It truly is the Nashville way to collaborate among all of us. Through Good to Go, we are sending a message to locals and visitors alike that Music City is safe and sound. Visitors can feel good to go to Nashville. Nashville is good to go in its response to COVID-19, and the businesses listed on the website and displaying the green note are good to go for customers. Good to Go will provide Nashville businesses with enhanced resources and best practices for a safe and long-lasting recovery and offer citywide consistency. We do not want, nor can we afford, another major setback. To our knowledge, this is the only program of its kind anywhere in the United States, and we think it is the best way to assure visitors and residents alike that Nashville takes health and safety seriously. Travel sentiment research has consistently told us safety precautions are a top concern when choosing where to travel and when visitors are ready to travel. So we reached out to Vanderbilt Health for assistance in creating a good housekeeping seal of approval to spotlight our members, local businesses, and show the world we are going above and beyond as a city. Through Good to Go, we will help Nashville businesses, 1, manage their physical spaces, 2, protect the health of their employees, 3, create consistent, safe customer experiences throughout the city, and 4, obtain the latest, accurate health information. Participating businesses must, at a minimum, commit to the city's public health department safety guidelines. We build on those guidelines through 3 tracks: professional development for businesses using Vanderbilt Health's expertise, peer-to-peer opportunities for businesses to share their best practices, and providing businesses with a comprehensive toolkit of branded resources that they can use in their establishments. Businesses that participate and follow the guidelines can display a green music note at their locations and on their website. That green note will tell customers that they are taking their health and safety seriously, that they are following health guidelines, and that they are committed to keeping our city safe for residents and visitors. As you know, destinations all across the country are starting to reopen. Good to Go will help Music City stand apart as a safe destination for leisure, convention, and business travelers when they are ready to start moving again. Visitors will be able to quickly reference the Good to Go website and see which businesses are part of the program. And the program is free. I don't think I've said that enough. Visitors are a vital part of our city's economic recovery, and we depend on them for tax revenue to support city and state services. In the coming weeks, you can see what local businesses are participating on the website, goodtogonashville.com. If you are a local business, we encourage you to learn more about the program and sign up for orientation at goodtogonashville.com. The orientation will take place tomorrow at 11 a.m., and already over 200 businesses have registered for the webinar. And we hope that through Good to Go, Nashvillians and visitors will see that businesses are following guidelines and protocols to make us a healthy and safe city. Thank you.
Thank you, Mr. Spearden. Let's begin today's Q&A session with Jeremy Finley at WSMV. Jeremy, you're on the air.
Good morning again. Thanks for taking all of our questions. I have 2 questions, one of them being, and please forgive me if you've already addressed this, but I wanted to ask about hazard pay for Metro employees ranging from various departments. Has the city been paying hazard pay, or have you seen a lot of requests from employees for hazard pay that have to go out into the public? And how are you going to deal with those requests? And second, I wanted to ask about, we're hearing some frustrations from people about employees in some businesses not wearing masks. I believe that we're still in the educational phase. So what do you say to people who have filed repeated complaints about businesses that where employees are not wearing masks, and these people say that this continues to happen? Thank you.
Thank you, Jeremy. Start with Mayor Cooper.
Thank you, Jeremy. On hazard pay, the Civil Service Commission has been meeting on this, and in partnership with the council going forward, I think we are all hopeful to use some of the CARES Act money as a hazard pay bonus for our safety personnel, which would be payable, frankly, in December. Again, reaching out to the employees, I think that's earned by this hard work. And again, with the various rules of the CARES Act and then our own Civil Service Commission Act, that appears to be the path for this going forward. And then here's Dr. Caldwell to answer your second question.
Good morning. We continue to receive information at 311, Hub Nashville on your smartphone or online, or the covid19.nashville.gov website. This has been an important time for us to get the word out about what's expected and what's required. And the time for education is soon coming to an end. We build a database. I work with my staff twice a day, at least, and monitor all the complaints we're getting. If we get more than one complaint, if we visit a place that we've visited already and have assured that they understand and know what to do, and we find a violation, we will begin the fining process. I expect that will be occurring over the next week. My hope is that we won't need to do that. My observations and the information I have is there's been overwhelming compliance. So if there are repeated offenders, they'll be hearing from us and they'll have to pay. Thank you.
Ian Jung at the Tennessean. Ian?
Good morning. I understand that Dr. Caldwell had sent an email this morning about informing will continue to share COVID patient data. Speak on that, and when reviewing the state's decision to reverse its policy and evaluating the situation, what does that mean? Aren't there better ways to achieve the same goal? And then hoping that Mayor Cooper can also topic and just talking about how he's communicating this information with some of the community partners we have. Thank you.
Thank you, Ian. Dr. Caldwell.
The Office of Civil Rights at the Department of Health and Human Services gives me, as the Director of Public Health, the authority to provide emergency notification to the medical and public health workforce, including emergency responders, to protect them and everyone else. This is an emergency. This is critical, timely, life-saving information that has reduced and contained the spread of this disease within our medical institutions and within our jails. I'm puzzled by why the state reversed course. We have, in Nashville, revisited this policy and we have made modifications and it is working. We must find a balance, and we have. Our policy is temporary. It is working. We have and we will continue all that we can to protect the public health workforce and our partners in a respectful and balanced approach. I am your Director of Public Health, and I will use all tools in my toolbox to fight this deadly virus in our community, a virus that Nashville has not seen for over 100 years. The emergency responders are our public health workforce partners, just as are the organizations and members of our diverse communities. This is a balance. I've asked Chief Swan to provide some other thoughts, and then Mayor Cooper can follow.
Good morning. I would just really concur the fact that this is about, at the end of the day, it's about stopping the virus, the COVID-19. And we're all obligated to be one partner. As first responders, we do everything that we can to make sure that we protect the citizens, visitors, and friends that come to Davidson County. But we also got to look out for our men and women as well. We've seen in New York, when this first started, they had over 1,300 first responders that was affected by this. But as Dr. Caldwell said, there is a balance. We want to make sure as we protect our citizens that they feel comfortable understanding that data sharing is just used for safety. It's used to make sure that we are protecting the men and women that protect you. And also, we want our citizens, visitors, and friends to understand that we've put a policy in place. We've got an MOU that we're working on and revisiting and making sure that everyone is comfortable understanding at the end of the day, we want to make sure that you feel comfortable knowing that we are sworn to protect and serve our citizens. We do that by being one unit and coming together as one. So thank you.
So, Yuhan, if you were breaking up on, I know you were asking me a question, which I'm happy to answer. You were breaking up during the question. If you could repeat that.
Thank you. I wanted to just kind of get your thoughts on the policy and how you're communicating some information to our community partners.
You mean our public health policy? Sorry. Okay, let me paraphrase the question that I heard is how are we communicating public health policy to our community partners? Well, through this press conference, I mean, I just recently heard about the state's change in its own policy. And we want to communicate and get feedback from everybody. I think you've heard pretty decisively from public health itself that if the city had information that kept people safer, why wouldn't you use that information? It's our obligation to use it super responsibly, of course, and we're pledged and committed to do that, and we want to work out with our community partners how to protect and use that information responsibly. But again, having it, our priority is public safety, and if we have a tool to keep people safer, then let's use that tool. We value our first responders. We value the effort and the risks that they take for us. Again, I understand everybody's concerns about privacy in America, and the pandemic is going to challenge them. But let's have a standard here that we can be effective with it, use it responsibly, delete the data when it's appropriate, have monitoring to make sure that we are handling it responsibly. But it would be much harder for me to say to a public safety officer that inadvertently was exposed, had a risk, contracted the disease, when there was something that I could have done that would have made them a little bit safer. I don't want to have that conversation either. But so thank you for your question.
Thank you, Ian. Julia Palazzo, WKRN. Julia?
Good morning. Thank you. Dr. Caldwell, can you confirm multiple people at a construction site on the campus of Montgomery Bell Academy have tested positive for COVID-19? And if so, how many, and how is the health department responding and monitoring that situation? And I also have a question for Butch. What concerns have you heard from travelers and from people who plan conventions and meetings in Nashville about the roadmap for reopening? And if you have received feedback, did that prompt the need to create this citywide safety program, or have you been developing this for quite some time to stay ahead and be proactive? Thank you.
Thank you. We'll start with Dr. Caldwell.
Thank you. Construction sites are a problem. And this particular one you're referring to was not just one company and one set of employees. It had to do with a number of different subcontractors coming in and out. And we're working with this particular construction site to make sure that they are following all of the social distancing protocols very aggressively, because I do not want any of our construction workers to be in situations where they're being put at harm. This now opens up the opportunity for all our other construction sites in Nashville, and there are many, to be responsible, to learn from this, and to know that I expect them to follow the rules to protect their workers aggressively.
Thanks for the question. First, it's a proactive measure. We subscribe to some research by a company called Destination Analysts, and they have been conducting weekly travel sentiment research since the end of March. All of that has consistently said visitors want to know what's the scenario in a city, what are you doing to be safe, what's your hospital situation, what's your capacity. So we started to put together a plan weeks ago. We're now ready to roll it out. We have been in contact with our clients weekly. I did a Zoom call yesterday afternoon. And after we share what we're doing, there are literally no questions. The only concern is, when can we have our meeting in Nashville again? So our clients and our visitors have been our biggest supporters, and we look forward to getting them back. Thanks.
Nancy Amons, WSMV. Nancy, you're in the air.
Hi, good morning. Thank you. I have two questions. First, on the notification policy, can you tell me how often you have used this, under what sort of circumstances, and how is it being monitored? And a question for Butch, about the 4th of July. Are you at all afraid of being able to maintain any social distancing if you have a large turnout? Because if you have fireworks, people are going to come. Thanks.
Okay, thank you. We'll start with Dr. Caldwell.
We have very clear documentation that this information has been used quite effectively. When I was touring the Emergency Communications Center, there was a call, and on the CAD system it came up, and there was a response made, and there was, right there, as the responding ambulance or officers needed to go, they knew, they were prepared to know that there was COVID at that particular location. Now, this information is temporary. It expires after a period of time, and that was when we revisited our policy to make sure that that information expired. So after a period of time, less than 1 month, the resident data falls off and is not available. It is only available if somebody gets dispatched and sees they must go to that particular location. Now, for individuals who are positive, that information also is expired. It expires once the person is recovered. It usually is about 7 days. Once again, that information is not available to anyone unless the officer or ambulance runs a particular name of an individual, and then that information comes up. We have documented cases where that has happened, and we believe that this has directly helped to keep the numbers in our jail low. We want to protect the employees and the other inmates. It only takes one virus to infect the whole jail, and we have seen that at a state facility. That has not happened in Nashville, and I don't expect it to happen.
Thanks, Nancy. Of course we're concerned. It is why we are emphasizing that it is a great time to watch the July 4th celebration on television. We also are making an assumption that we will be in phase 4, which allows for more and larger gatherings. If that changes, then we might change something with regard to the celebration. The bars on Lower Broad will be open. The rooftops are a great place to view. The parks will be closed. We're going to continue our messaging, and we're also going to say, if you come out, wear a mask. Be kind to your neighbor and be smart. So we have the concern. We're working with Metro Police. We're working with all of our partners to do everything we can to give Nashville a bit of a celebration, but do it responsibly and safely. Thank you.
Kara Hartnett at the Nashville Post. Kara?
Hi, thanks for taking questions today. I have two for Mayor Cooper. Is the Good to Go campaign encouraging tourism, and do you think that's appropriate? And can you talk about the coronavirus-related construction project at Nashville General? Like, why is it necessary, what's being done, and how will it be converted after the pandemic?
We'll start with Mayor Cooper on your first question.
Thank you, Kara, for that question. Good to Go is let's get ready. Let's get ready. You're going to have to rehearse and prepare and have a high standard, as I was talking about in my remarks. Nashville needs a reputation for safety as well as being safe. And we're going to establish that reputation, so we're going to be the place in the country that people really warmly want to come back to because we're doing such a good job. And appreciate all the businesses having a uniform standard of compliance so that our citywide reputation is really going to be enhanced after that as the one place in the country you for sure want to go. And I think Good to Go is going to help motivate and provide the boost for people to think of it that way, that we're all in this together and we're all participating together and we're having a high uniform standard of keeping people safe. For the Nashville General construction, at one point, I talked about this a little bit earlier, there had been a vast need for emergency beds. Fortunately, blessedly, we don't have to have that. We don't have to have 1,600 emergency beds. It would have been tens of millions of dollars or more to bring that facility online. Instead, the state particularly has a sort of a plan B for increased capacity if we need it, if there's a second outbreak, so that we are super well prepared. We have the time. The slowdown in the virus gives us time for a good response. And obviously Nashville General, which had some floors that needed some additional improvement on, is able to help respond to that challenge. And it's going to be a blessing to have additional COVID capacity beds in the same building as an ICU. Couldn't be in a better place. In the meantime, Nashville General, I think, is going to be able to attract additional dollars for its improvement and the building out of these floors from this. So it's hopefully, and we're not allowed to call it a long-term benefit because the CARES Act money doesn't allow you to use that kind of terminology, but in reality, it is going to be a continuing benefit for the community to have investment in that building and that facility, and its ability to provide such high quality care for COVID patients that are in the building it's exactly where it should be. There may be other facilities that the state also tries to locate within the Davidson County region so that we are certain that our hospital utilization and metrics are going to be there should there be a second outbreak. I hate even to have to remind people there could be an outbreak. We could be right back where we were, but when that happens again, we're going to have tests, we're going to have masks, we're going to have hospital capacity. We're going to be much better prepared than we were last March. We're not going to go back to where we were then. And this is all part of making that a consistent response. Again, I just want to thank Nashville General, and it's super that we are able to add capacity right where it should be, right next to a major medical facility. Thank you.
Our final question this morning is from Harriet Wallace at Fox 17. Harriet?
Yes, hi, good morning. I've got a question, not exactly COVID related, but one that some are considering partly a health crisis, talking about the interaction between police officers and community members. In light of what's going on in Minneapolis and what we've seen recently here in Nashville, the question continues about the rollout of police body cameras. Mayor Cooper, I know you mentioned the cost associated with it right now. My question is, in following this, we've learned that the DA's office has rolled out a pretty complicated and expensive maintenance program, which is causing the lag in being able to roll out the cameras. With something so important to officers and the community that I've heard from, have you all looked at an alternative maintenance plan that could help us move forward with the body cameras? If you have, why was that program alternate not chosen? Or would you consider, if you've not, would you consider looking at an alternative that could finally get body cameras rolled out? Thank you.
Mayor Cooper.
Yeah, thank you, Harriet, for raising attention to obviously what is an important and vital community concern and need. Before the pandemic kind of broke, that Nashville was in the middle of a pretty robust pilot. We'd brought in a bunch of experts from the Justice Department who have successfully implemented body cameras in other cities, and to try to learn from them about, before we spend tens of millions of dollars, what are you getting for that? Is it effective in the end? The point of body cameras is to create more justice. Are you getting justice out of the end of body cameras? It has to get beyond just storing footage. It has to be integrated into creating more justice. Are we doing that? Nashville was on a path of having somewhat of an unusual vendor strategy. And of course, we wanted the Justice Department's consultation on whether we are contracting for the right services with the right vendors to get the job done. Most cities, I think people in Nashville need to know this, most cities do have body cameras. We are behind. It's something that we have to catch up with. Being slightly behind, though, is a learning opportunity for us. And let's use that learning opportunity. But we are on the path. The pandemic has interrupted a lot of essential community spending. And I'm using that, it's a big word to use, essential community spending. Why are you delaying that? Well, there's a pandemic. Right now, we have to balance our budget. We have to get employees paid. We have to get the work of the city done. Projects that were complicated to rolling out, where the implementation itself needs to be discussed and worked through with the Community Oversight Board, with the Police Department, with the DA's office, with the Public Defender's office, in a way that delivers this service in the best possible way for the public. And we gotten interrupted by the pandemic in doing that, but that is for sure our goal at the end of this. And if we figure out a way of doing it for $10 or $20 million less, well, sure, I am for that too. But you have to determine that you're providing the essential service that we are looking to body cameras to provide, which is more justice in our community.
Those are all the questions we have this morning. I'd like to thank Mr. Brian Hassett and Mr. Butch Spearden for participating in today's press briefing. The next scheduled Metro COVID-19 press briefing will air on Monday morning, June 1st at 9:30 a.m. Remember to visit covid19.nashville.gov to stay up to date on Metro's coronavirus response. Thank you for joining us. This concludes today's press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.